By the year 2050, chronic diseases like diabetes and heart failure will account for 86% of all deaths worldwide. The global population is aging rapidly, and our medical infrastructure is bracing for a tidal wave of patients. At the exact same time, the doctors meant to treat this surging population are buried in administrative gridlock. Today, physicians spend 35% of their working hours on paperwork rather than direct patient care. These two compounding pressures create a system that is almost entirely reactive. Hospitals are forced to act as triage centers, equipped primarily to treat people only after their conditions have reached a critical, life-threatening stage. There simply aren't enough new doctors and nurses entering the pipeline to handle this volume. Human resources alone cannot scale fast enough to meet this incoming demand, without the system buckling under the weight. Artificial intelligence enters the picture as a massive operational multiplier designed to clear these bottlenecks, rather than a robotic replacement for human physicians. To understand how this works in practice, we have to look through three distinct lenses: the macro level of hospital management, the meso level of clinical diagnosis, and the micro level of patient monitoring. Securing the future of medicine requires a synchronized upgrade across all three of these scales at exactly the same time. Let's start at the macro scale. A modern hospital operates like a small city, and right now, many are logistical nightmares suffering from chronic inefficiency and the misallocation of highly expensive resources. In this calendar grid visualization, we can see how algorithms act as high-speed traffic controllers. By analyzing historical data, they predict patient no-show rates and automatically optimize appointment slots. As we pull back to the hospital floor plan, we see that same continuous calculation applied to physical space. The system analyzes recovery data to estimate precise discharge timings, clearing out beds exactly when they are needed and preventing dangerous overcrowding in the emergency room. And because it tracks the flow of patients days in advance, the software can forecast future staffing needs, matching the workforce to incoming patient surges before they actually happen. This high-level optimization strips out the wasted hours. The direct result is shorter wait times and the assurance that critical resources reach the most vulnerable patients faster. Zooming into the mesoscale, we reach the exam room itself. The first point of friction here is the mountain of documentation required for every single visit. Instead of a doctor typing while you speak, generative ambient scribes securely listen to the consultation and automatically draft the medical notes. The physician can finally maintain eye contact with the patient. Moving to diagnostics, computer vision models are reviewing medical imagery at massive scale. In fact, radiology currently accounts for 76% of all AI medical devices approved by the Food and Drug Administration. Looking at this medical scan, we can see how these vision models analyze imagery for diabetic retinopathy, breast cancer, and stroke indicators. By isolating pixel-level abnormalities, they operate with up to 20% fewer errors than the traditional human baseline. Beyond imaging, predictive analytics constantly monitor patient vital signs across the ward. They can flag deadly, fast-moving conditions like sepsis hours before a patient physically crashes. At this clinical scale, the technology acts as a tireless safety net, catching the subtle details that slip through the cracks and reducing fatal human errors. Finally, we zoom all the way down to the micro scale, the individual patient living at home with a chronic disease like diabetes or a cardiovascular condition. AI-powered wearables and remote monitoring systems are now continuously evaluating streaming health data far outside the hospital walls. By analyzing these daily data streams, the software detects subtle physiological deterioration early. It can suggest adjustments to medication and alert human care coordinators to step in before a medical crisis occurs. This continuous remote connection accomplishes the ultimate goal of the entire healthcare system, keeping patients healthy and keeping them out of the hospital entirely. When you combine the macro logistics, the meso diagnostics, and the micro monitoring, you get a highly integrated, tightly coordinated medical network. This seamless data flow facilitates a massive transition in how we approach wellness. It moves us permanently away from reactive sick care and toward genuinely predictive healthcare. There is a deep irony here. The greatest initial fear surrounding automation was that it would make the medical experience feel cold, distant, and robotic. But by offloading the complex scheduling, the endless paperwork, and the heavy data crunching to machines, we are returning the most valuable tool to doctors: time. And that time is exactly what makes medicine human again.